And that's why you're a power mum. Welcome to the Pwrmums podcast.
So from a medical perspective, when you go see your gynae or obstetrician at your 6-week checkup, they're making sure that your uterus is contracted appropriately. They're making sure that any wounds, Caesar wounds, perineal wounds are all healed well. That's their main focus, which is great, because that stuff's pretty important. And then they usually give you clear, you're all good. But we're looking and definitely more in depth, more at how functionally stable already a woman is to go back to doing the type of exercise that she wants. And it's also dependent on what a woman was doing during pregnancy as well. There's an element of that. Obviously, we're looking at very specific things, but a woman who's been on bed rest for the last 3 months of pregnancy is going to be in a very different situation to a woman who was able to continue to do her Pilates and her yoga and her hour
running
walks every day, sometimes even running, some weight training. That we've got to look at that whole picture, because it's very, very relevant as well.
So the 6-week check, no 2 6-week checks are alike.
No, absolutely not.
Definitely not.
Yeah.
Definitely not.
Because it will vastly depend on what that person's fitness is pre and then at that point in time as well, because we do get women who, even if they were very fit up until the end of their pregnancy, 6 weeks of not doing the same level of activity can really decondition you. So getting back into gradually building up, we need to sort of sit down and talk about realistic goals, understanding the time scales, but then seeing and it depends on your delivery as well vastly, right? Because if you've had a very, a more traumatic delivery that has caused, and when I say traumatic, I mean more traumatic to the pelvic floor, I suppose, and you do have a lot more laxity in the vaginal walls, and that perineum is not as well supported as we would want it to be, we need to consider the time scale of getting back to doing exercise that puts a lot of strain in that.
There was a study a while ago where they did MRIs on pelvic floors immediately I think 6 weeks postnatal, within their first 6-week period, and then they saw that in some deliveries the trauma that was there was equivalent to significant sports injuries. And somebody who had a sports injury like that caused that sort of trauma would be told, you've got 9 months rehabilitation ahead of you. And these women are being told at 6 weeks they're good to go. And that's, I think, the message we're trying to get across to our patients, is that you've just got to give it time, and if you do it sensibly, usually you can achieve the goals that you want to. But we often see women who maybe aren't planning on coming for a 6-week check, so they get the go ahead, off they go straight back into running or the CrossFit or whatever they want to do, and they end up either with perineal heaviness, or they end up with leaking of urine or back pain or whatever it might be, and then they come to us and they say, I don't think I should have done that.
Yes, which is a shame. So we love women who are coming to us first of all, we love women who come during pregnancy in our preparing.
Does that help? Does that make your job easier when you see someone before they've given birth?
Absolutely.
Big time. So we love everybody out there who is pregnant and want to have a better plan postnatally, is to really come and have an assessment of your baseline, because we can then see what your pelvic floor is looking like, what your understanding of your breathing and your abdominal control is looking like as well. Because although that's very different during pregnancy, with your diaphragm being stretched and your abdominals being stretched, we can already start giving some good information on how to and also how to approach that first stage of 6 weeks of healing. We do have some good research to back up our advice in terms of what we should be doing about healing the abdominal muscles and the pelvic floor in those 6 weeks. So that kind of stuff. So it's very valuable coming antenatally.
And you would hopefully stop that 40% of women who were doing their pelvic floors by bearing down.
Correct. That's exactly right.
Yeah. And there's a lot to be said as well, just from a labor point of view, in understanding. I think I find it really helpful, or the patients who have been, and the doulas, they give very good feedback afterwards to say, I think them understanding how their pelvic floor moves and how the control is there during labor can be a valuable thing.
I think that's really relevant because I think a lot of women only focus on the contraction phase of pelvic floor, so they're all about activate, whereas actually we teach that the relaxation phase is as important as the squeeze phase. And that brings us to another whole topic, which is talking about pelvic floor muscles that are overactive, that are hypertonic, that are too tight, right? Which we see a lot as well.
That's more of a problem, right?
Well,
it's always been. I think it's just it's more identified now, and it's more being written and studied on the overactive pelvic floor. I think, which wasn't before. So that's where the whole Kegel thing comes very much back from the 1950s. Is very much that women were all thought to have low tone, weak pelvic floor postnatally, and so get those pelvic floor muscles tightening, and unfortunately we get still some people who advise hundreds of Kegels.
300 Kegels a day.
Yeah.
300.
No, exactly. And so we understand because no one pelvic floor is exactly the same as the other, and so understanding a few signs to look out for, even if you can't have your pelvic floor checked, is understanding, okay, can I feel, like Tamara very precisely said there, can you feel the let go, the relaxation part of the contraction?
And it should feel as obvious as a squeeze. So if we're all sitting here now and we think about lifting our pelvic floors, when you release, that release should feel as obvious as that initial squeeze. And that's what a lot of our patients say to us is, I can feel it activate, but I actually can't feel the release.
Are women frightened to relax their pelvic floor because they're worried if they relax their pelvic floor, it's all going to go?
So I don't think they're necessarily frightened, but what happens in women who do have prolapse or perineal heaviness or they have incontinence, they actually unconsciously are actually holding on. Right. So that's what we see. So those women come in to see us and they actually don't even know, they don't even realize that their pelvic floor muscles were switched on the whole time.
And equally on that basis, sometimes as we know, you may even have somebody who hasn't had children before have prolapse, but who have a very overactive pelvic floor. And that sometimes can be linked with women who have had a chronic history of painful periods, like endometriosis is something that you often see overactive pelvic floor because you have visceral pain that has to be protected. It's like when you have back pain and you have your muscles all spasm around that. And so it's similar picture, and equally women who have had a history of chronic back pain or have had a big episode of sciatic pain, the pelvic floor can be, because it's a surrounding muscle of the area, may get also overactive and tight
it's
and
a
tense.
Muscle. It's a muscle very important for women in childbearing years, but it's a muscle for everybody. It's even a muscle for men. Muscles for men.
Yes, absolutely.
That's absolutely.
We're not going to talk. You might have to get Karen Edwards on your podcast to talk about the male pelvic floor.
And can we talk some scenarios regarding the 6-week check? So we've gone into quite a lot of depth about what you look at, but so if somebody's had their second baby and they came to you after their first baby, they might say, "Oh yeah, I saw Tamara, it was fine, and I know what to do." Should someone still come back after having a subsequent baby for their 6-week check?
Absolutely, yeah, absolutely. And actually, any patient who's seen us after their first,
they
all come back. They know what we're looking for, but it's great because, as Monica's already said, then we've got information of what their pelvic floor was like previously, and we can do that comparison. We can give that reassurance, hopefully. But yeah, it's super important. This is important at every stage in our lives, and even when we go through menopause, we tend to have a change again in our pelvic floor health, and then often women want to check in. But we actually, Monica said we love seeing women when they're pregnant. We also love seeing women before they even pre-conception. Before.
You ladies have not got time to see the two busiest ladies in Singapore.
But it does make a big difference.
So in an ideal world,
in an ideal
everybody
world,
through every stage.
That's right.
In an ideal world, I mean, I think that's my personal anecdote in terms of family life and already having a teenage daughter. That is something that starts from young age. I mean, we know that pelvic floor education starts from children, because when we're asking our children to be potty trained and to understand how to control if they need to hold on and so forth, and not educating them to go to the toilet and have a pee just before you go out of the house, even if you don't have an urge. Those are things that we're training and educating girls and boys about their pelvic floor and their continence. But with teenage daughters, when they start contemplating the fact that they may need to put a tampon in, if that's something that they want to go and do sports and they want to understand, that whole conversation has to start from that age as well.